and we are delighted to be able to have this session. I know it's kind of been a long time coming. So I will start with Mr. Stanley, please.
Firstly, we'd like to thank the committee for the opportunity to come and speak to you today. And I'm joined today by my colleagues, Karen and Aisling, who run the dedicated youth service in Galway Simon. And it's a service we're very proud of, but also a service that's identified a number of the issues we're going to talk about today. Just to say, the Simon Communities are also a member of the Irish Coalition to End Youth Homelessness and also sit on the National Homeless Action Committee. And in these roles, we are ongoing collaborative dialogue with the Department of Housing in the development of the upcoming Youth Homelessness strategy. Today, we wish to highlight the needs and experiences of young people who experience household disruption or adverse childhood experiences but never officially enter state care. We see that these young people are overrepresented in homelessness as they fall through the cracks of support systems. We bring this discussion to the committee as we believe that there's a potential to reduce the experience of homelessness for these young people through targeted intervention and collaboration. In our broader submission, we've also highlighted the needs of young people leaving state care. This group are an identifiable population, meaning that it's easier to target housing supports and homeless prevention. However, our focus today lies with an additional cohort who experience adverse childhood experience but are not taken into care. Some of these may be known to TUSLA due to welfare concerns, likely because they experienced family breakdown as a late teenager, but did not officially enter care, possibly because they aged out, or circumstances at the time were not deemed to be at a level of risk that warranted significant intervention. This can include those who had experience of abuse, who were surrounded by addiction, or who experienced family breakdown in their late teens. Studies show that these young people are overrepresented among early school leavers, experience high levels or high rates of mental health difficulties, and are overrepresented among the homeless adults compared to the general population. The concern here is that this group is, to a certain extent, currently unknown or invisible, and therefore there appears to be less awareness of their needs, which we fear is compounding the issues. These young people often require support, but they are falling through the cracks of our support system, making them vulnerable to homeless poverty and educational disadvantage. They do not have access to social support similar to those provided in aftercare, which prepares young people for the transition into adult life. They often receive a lower social welfare rate, which can compound the risk of poverty and housing insecurity. We fear that they are vulnerable to hidden homelessness as they do not have support to navigate or afford the housing market. They are not entitled to housing support or targeted homeless prevention, such as the CAS for care leavers support, which through TUSLA and the Department of Housing. They are not currently entitled to additional educational supports for children in care and aftercare, such as the TUSLA and DCE DIY bursary scheme. The upcoming homeless youth strategy appears firm that it will focus on young people after the age of 18. However, the threat of homelessness and housing insecurity begins well before then. Therefore, TUSLA, in particular, can play a central role in protecting this group from housing insecurity. A coordinated, universal response policy measures can be developed and implemented to protect this group from homelessness and housing insecurity as they enter adulthood. There's a number of recommendations here, which is, I suppose, additional key workers who can provide the support into early adulthood, including homeless prevention. The CAS scheme, which I just mentioned, existing homeless prevention policies, such as the CAS for care leavers, could be expanded to adapt to be more inclusive of all young people at risk of homelessness. Improved social welfare. Young people under the age of 25 are still subject to a lower social welfare rate, while some categories of young people have been included in the higher social welfare rate, but this particularly welfare group are not. This compounds their risk of poverty and homelessness. And increased collaboration. The Galway Simon's dedicated youth service is a prime example of successful collaboration between a range of stakeholders. A multi-agency partnership that exists between Galway Simon, Galway City Council and TUSLA to ensure youth services are well informed and young people are well supported proves efficient in the outcomes that it is having for young people, such as increased employment in the group. There is further potential in this model if appropriate housing can be sourced. While this might look different in other areas where working relationships differ, the core principle of a dedicated partnership service has proved very effective. The Simon Communities of Ireland see value and potential in this model and wish to work with the committee and other agencies to promote and extend this type of collaborative work. Thank you for your time.
Thank